This is a slightly different one. This is in NHS Wales. And what they noticed was staff psychology. So the staff wellbeing team were noticing that more staff members were presenting with high levels of distress. And the underlying when they looked into why that was the case is that many of these were coming in because they were undergoing an employee investigation. So essentially, complaints come in, they've been suspended, an investigation gets launched. It's a very distressing situation. It goes for 6 to 9 months. People feel very lost, so high levels of distress. People don't know, have I got a job? Might there be a criminal complaint? If I've come from abroad, may I lose my visa? Might I get deported and so forth? So, it's a very distressing situation. So some would argue and say, actually, the system is working because, complaints come in, investigation is launched. If someone gets distressed, they're getting the help that they need because they're going to see staff psychology team. But further exploration, they started talking to HR. It's the first time they talked to HR formally, and they realized that the vast majority of people who go through an investigation receive no sanction. Which then leads to the question is, why are we putting so many people through what is a distressing position when they don't actually have to go through this process altogether? So long story short, it's essentially a culture change piece to say, actually, how do we increase awareness across the organization, across key stakeholders, that the employee investigation process is potentially harmful to our colleagues? So how do we improve the process so that we can upfront some of the work? So rather than immediately suspend someone, that we can look and say, can we take some time to look at, is there actually a case over here that warrants some of the work to warrant someone going to investigation process? Might there perhaps be alternative routes, whether that is mediation, is this potentially a training issue altogether over here? And also, how do we improve the employee investigation process in general? Because, how do we make it quicker? How do we improve communication to support individuals when they are off because they've been suspended over here? And long story short, there is a paper over here if you want to read about it in more detail. But after a year, essentially what was found is a 71% reduction in investigations, and that was 35 individuals, which might not seem like a lot, but 35 individuals who don't have to go through what is essentially quite a distressing situation over here. And we know that even if you receive no sanction, a lot of them are then on long-term sick leave because they've already been distressed in that situation. And even if they're well enough to come back into work, some actually say, I don't want to work for this organization anymore because they put me through this process. At best, they might work for another healthcare organization, or alternatively, they exit the healthcare sector altogether. So the direct savings over here, 3,308 sick days saved, and financially, £750,000 in terms of direct savings over here. So what we see over here is what is actually seen often as a HR issue, but a change and improvement in work processes, improving the work experience of staff, but actually having a beneficial impact on outcomes for the organization as well. And I know many organizations are thinking about, particularly in healthcare, on sickness absence days and of course agency spending as well. So some of the implications over here. So why wellbeing interventions? If I were to summarize the across the 20 interventions, often is because they only focus on one level. They only focus on the individual. What are you doing to support your staff? We've got an app, we've got mindfulness, you can talk to a psychologist, we've got an employee assistance program, we have resilience training. It's off the shelf. Where it's a bunch of stuff which we think that all organizations are doing, the vast majority of things. So we're doing it because it looks like it should be what we're doing, but we're not actually stopping to ask the question, what are our demands? What are our resources? What are our challenges over here? They're often top down, they're externally driven, they're what everyone else is doing. It's something that maybe a certain directorate, whether that's HR or OC Health or senior management, are pushing down and actually not understanding what the experience of colleagues at the grassroots are over here. It's not backed by the right stakeholders, so it's doomed to fail. They're not evaluated over here. So if people are not understanding what's happening over here, then actually we're not able to improve. And lots of organizations are spending lots of money on wellbeing interventions, but have no idea actually whether they work or not. And they take a very short-term perspective. They're not thinking about how do we embed this in terms of our wider system. How do we maybe put this in terms of accountability mechanisms and processes within the organization? How do we think about funding this perhaps over a longer period of time? How do we build this into the workloads of individuals that we have over here? So we kind of end with 6 principles just to think about. And people often say, what's the best well-being intervention? What should I be doing over here? And we think it's actually far more useful to kind of think about this with these principles in mind. The first thing is recognizing that staff well-being is a systems issue, and whether you're in healthcare or not, it's actually recognizing. You can take the igloo model and say, what are we doing across those different levels? We have demands and resources and pressures across all of those levels. Some of these we have control over. Fair enough. Some of these we don't. We can lobby and we can push for that, but there are things we have agency over as well. So how do we control and try and influence change at that? We have to tailor the intervention to the context, because just because something works somewhere else doesn't mean it's going to work over here. What is our issue over here? As a simple example, the MDT meeting, those meeting guidelines they put into place, that that worked really well in that team. People were very happy. The team got half a day back a month to do catch up on their workload. They tried to roll this out across other teams, but other teams pushed back because they say, well, why are we suddenly being told how to do our meetings? This is not an issue for us. Or a different example altogether. One of the teams, one of the interventions put in place a self-rostering system, and that made a massive improvement in the quality of work for nurses in that trust. But the exact same branded self-rostering system was the source of problems in a different trust altogether. So just because something works in place A doesn't mean it's going to get work in place B. So what we have to do is we have to involve staff in the process to understand what are the demands, what are the resources, what are the challenges, what can and should we be doing in this situation over here. We need to get support for our leaders, because if our leaders don't buy into that process, if you've got leaders who are saying, a good midwife does not get tired, you might have to challenge the mindset of your leaders over here. I haven't really gone into talking about politics and dynamics and power, which actually power is a big part over here. But how do you recognize who holds power within that context? If you want to drive change, you kind of need to bring this to the attention of the right people. And the employee investigation process, that intervention, one of the things they did was they developed a template case study with kind of 4 different implications. So what's the implication for individuals? What's the damage in terms of reputation to the organization? What's the implications for the workload of individuals within the system? And those different case studies with those different outcomes importance, they took to different stakeholders. So when they spoke to senior management, they presented one example. When they spoke to trade unions, they presented a different example. It was about making that case to the different stakeholders as to why you should be invested into whatever we're trying to do over here. You have to recognize that interventions are iterative. Too often we think that interventions are you do an intervention, that's done. But in practice, organizations are complex. They're always changing, resources change, demands change, and we make mistakes, we get things wrong. So that's why evaluation is really important. One of the other interventions that we had, they actually recognized it was a self-rostering system, but they realized that nurses who had come from abroad were actually not engaging in this system because they just didn't understand how it worked. They didn't have access to the technology, so they had to improve how they were rolling out their interventions to ensure that everyone benefited from what they were doing over here. And then finally, planning for the long haul. So, thinking, as I said earlier, on how do we embed this? And in some contexts, it might be piggybacking onto other processes that you have. So some found it quite useful to talk about it in terms of quality improvement, as one example from that perspective. So thinking about how you embed it alongside other things. So whether it's data collection, staff surveys, and other initiatives that are happening over here. So in conclusion, we have to recognize that organizations continue to change, to adapt. There are different demands and resources at all levels of the igloo: individual, group leader, organization, the overarching context. People sometimes say organizational interventions may appear complex and overwhelming. We're not talking about, a massive organizational restructure involving a big four consultancy firm. You can if you want, but what we also see is, simple changes at a local level can have quite a big impact in terms of the work experience of individuals. We're not talking about fixing the whole NHS. We're talking about making a slightly better a difference, a better working environment today than it was yesterday, and using that to create gradual change and improvements. The 6 principles hopefully are a useful starting point to get people, teams to think about supporting and creating and sustaining interventions over here, because through our examples and through our work we see that even slight changes can make substantial improvements in the working experience of staff, and that change is possible. And just to end, you've got my contact details over here. If anyone's got other questions, please feel free to get in contact. The report, the main report that I've just primarily talked about is this one over here. If you look it up on Google on the Society of Occupational Medicine website, it's on there, Organizational Intervention to Support Staff Wellbeing. But we've got another report looking at the role of occupational health and HR coming together and taking that systems perspective to support mental health and well-being in the workplace. And again, that's hopefully got some resources that are quite helpful for individuals. But in a nutshell, that's what I wanted to cover for today, and happy to take any questions, comments that people might have.
Thank you very much, Kevin. That was an excellent presentation and a really interesting overview of I suppose some of the challenges of addressing well-being within the workplace context.